And we have about half of the group says yes. Their organization does have an implementation plan to address tobacco. We have a pretty big group also saying that they're not sure, which is understandable. Some people are at big agencies that can be complicated and they may not be in on the process, and about 20% say no. So I think we're going to begin. Good afternoon. And just for housekeeping, if you're joining us now, please add your name into the chat box so that we know you're here. It's our way of taking attendance. We're really glad you're here today. And we're also going to use the chat box for our question and answers at the end. So please write any questions you would like us to address into the chat box, and we will go to those at the end. My name's Jill Williams. I'm going to remind everyone the session is going to be recorded. Slides will be available for future viewing and posted on our website. All the documents also that we discussed today are available on the TCTTAC website under the section marked Tools. So welcome to this webinar called Using the Tobacco Integration Self-Evaluation Tool. We refer to it as the TiSET, and it's a measure that we developed for quality improvement. The webinar today will be presented by the TCTTAC team. TCTTAC stands for Tobacco Cessation Training and Technical Assistance Center. My name is Jill Williams. I'm an addiction psychiatrist, and although I'm based in New Jersey, I'm also the medical director for this project of the TCTTAC program. I'm going to be presenting as well as the other members of the TCTTAC team. So just to briefly introduce you to them, you may know them already through their work at CPI, Dr. Nancy Koval, who's our project director, and our implementation specialists, Rusty Foster and Noah Lipton. We don't have any information to disclose today, no disclosures. So our learning objectives for the webinar today are to understand the steps for incorporating tobacco treatment into your behavioral health program. We're going to talk about an important step in that process, doing a self-assessment, which you might do with the tool that we're going to describe called the TiSET. And we're going to go through describing the development of the tool, how you use it to do a self-assessment, and what you do with those results. And remember, at the end of the presentation, we will have time for question and answer, so feel free to put those into the chat box. This is sort of the view from above in terms of thinking about implementing change into your program. For integrating tobacco treatment into your program. And so we have developed several tools into this overall model to help you hopefully with this process. So I'm just going to walk through this. We have a document called the Steps for Incorporating Tobacco Treatment into Your Program, and I'll briefly talk about that. That's sort of the view from above. How do you begin to implement change at a high level through your program in a way that can be successful? An important step in that process might be to conduct a self-evaluation, and that's what the TiSET is. It's an instrument designed to do that. That can be a really key step in understanding where your agency is at today, helping you identify the strengths and weaknesses and areas that you might want to work on. If you go through the process of completing the TiSET, we are able to actually take those results and generate a report for you, essentially feedback or summary about how your agency is doing based on your answers of the TiSET. And you can really use that as an important guidepost in thinking about what steps you might want to take subsequently or how to prioritize that. We have another document called the Treating Tobacco Roadmap, which then helps you break down if you want to do specific pieces. We have suggestions, tools, strategies that might help you to work on specific focused areas. So we hope that all of these tools are useful as you move this process forward. Again, we're really highlighting just a piece of this though today, which is the TiSET self-evaluation tool. So again, there is the document on the steps for incorporating tobacco treatment into your program, and I'm just going to very quickly go over these. You may have seen models like this for integrating tobacco into your program. Our model is sort of a modified version of some other models where we really are emphasizing treatment in particular. But you can imagine these would be important steps like involving leadership, developing a work group, having a champion, people that are really passionate about moving this issue forward. You might have a kickoff event or other ways that you publicize the work that you want to do. You can see that one important step is completing the TiSET, which is, of course, our focus today, the self-evaluation step. You would want to use the information from that to develop your implementation plan, which is essentially like an organizational, kind of like a treatment plan that would help you think about the next steps and help you to prioritize those, really strategize and think about who might actually work on those specific steps. It would be important to distribute your plan to others and have a good plan for communication. You might want to conduct training for people to support your implementation. Of course, people need supervision in addition to training, especially if they're doing this for the first time. It might be important to track outcomes so you can measure how you're doing and sort of adjust your plan, monitor it, and update it over time. So I would refer you to this document if you wanted to read about the steps in more detail, but it just sort of gives you the view at high altitude in terms of looking at the overall plan. So we said one of the key steps in this process might be to conduct a self-evaluation of your program. The point of that is to try and understand where you're at today. What's our current capacity for treating tobacco? If our goal is to increase capacity over time, how do we do that? What are the steps we need to take? How can we plan and implement that plan in a way that we're really successful? Along the way, you might want to look at other policies that the organization has in place, practices, what's your workforce capacity, how is this going to fit? Because obviously it's going to be unique for each different site based on your needs, based on your patient population. So it's something that might be highly adapted to what serves you the best. And also helps you, again, identify with the report some feedback areas to work on and establishing priorities. We have to be realistic. You may not be able to work on everything, but how can you sort of come up with priorities that make it more doable over time? So the tool we're going to talk about, as I said, is called the TiSET, and we're going to describe the instrument in some detail. It's broken down into 6 domains, which NOAA is going to describe, which really look at the different key areas where you might be influencing this tobacco treatment service based on policy, environment, screening and assessment, treatment, working with staff and providing training. You're going to look at the specific items in the TiSET based in these domains and be able to score them on a scale to understand where you're at today versus not implementing this practice at all the way up to fully implementing it. So again, we'll talk about the domains today. We'll talk about how you might use the tool, how you might conduct the first completion of the self-assessment, how the scoring is done, how doing the TiSET generates a report that hopefully gives you feedback for your program that allows you to then prioritize different domains to work on, how you can link to the roadmap, which helps you then work out specific steps that you'd like to follow up on, and how you might think about not only doing this instrument once, but at different intervals to allow you to track your progress. So that's the sort of the overview and introduction. And now I'm going to pass it to Noah Lipton, who is going to speak about the domains in more detail.
Thanks, Joe, and welcome everybody. With each of these slides, I think there's about 6 or 7 of the different domains we're going to be looking at. You can see some of the kind of highlights or takeaways that we really want to emphasize in addressing each of these domains. So to start with, policy and administrative, and on the bottom, you'll notice that the last bullet indicates how many of the items in the TiSET itself address this area. So there's 2. And really, it's policy and administrative is kind of looking at that sort of highest level of oversight of our effort to address tobacco. And really, policy sets the tone. And certainly if we're looking at outcomes, particularly related to tobacco, that's part of how we can sort of offer administrative support in an ongoing way that's going to help sustain our effort and see how we're doing and allow us to make changes over time. Okay, thanks. And, now on to an environment. And environment also, I think, sets the tone as well. And this on a more, in a way, kind of a day-to-day basis, right? It's what staff see every day. It's what clients see every day. So what does our signage indicate? What do we offer in terms of messaging around that our program is one where you can seek assistance, for tobacco use? That it's something that we think is important, that we feel also competent and able to address, right? So these are all things that can be indicated and reinforced by our environment. And you'll see here too that we have, there's two particular measures or questions that are asked in the TiSET that kind of speak to this important piece. Next is screening and assessment. This, I think, is such a key element because it's really hard to address something when you don't know that it's an issue, or you don't know how substantial an issue is across your population. So screening really gives us that information. So we really want to, screen everyone and screen everyone on a regular basis. We also not only want to screen whether a person is smoking or not, but also how severe is their tobacco use disorder, because that helps us in terms of determining treatment and what are individual people's treatment needs as well as the larger group's treatment needs. So we're following up our screening with assessment that's going to look at things like severity, but also aligning with how severe. What are in essence, what is the stage that someone is in, which again kind of speaks to the treatment needs that someone has, which could be individual, group, as well as medication. And certainly, psychiatric practitioners play a really important role because medication and NRTs is so key in helping the people that we serve, in many cases, address their tobacco use. Not to mention just as well that in addition to doing it, we also have to document, of course, what we're screening, what we're assessing for, and that's also something that's spoken to in these items. Treatment, as I was just alluding to, of course, follows screening and assessment. So once we have a sense of where our population is in terms of their smoking, how severe it is, where they might be in terms of their stage of change, then we want to link each person to appropriate treatment. Right. So are our treatments stage-based? We're looking at things like that. Do we offer a range of different types of treatments, individual treatment, group treatment, again, medication and access to a prescribing clinician? All of these things are so kind of integral to providing comprehensive care. So these are the types of things that, again, that we're kind of addressing in these 5 items that speak to treatment. Staffing, of course, is another important one. And here too, it's everything from, is our staff kind of, in some ways, is it a sort of diverse staff, right? That can kind of speak to people's, varying needs in terms of clinical staff, psychiatric staff, and peer staff that are able to kind of directly assist people with their tobacco use. Are we also, providing support to staff that may smoke and may have some interest in quitting? And providing them either with links to to healthcare or to support services that would be able to help them in that arena. And certainly that's something that we want to do because it's modeling, of course, for those people that are making an effort to their own smoking for the clients that they serve, and also clients that are actively smoking may find it more difficult, to provide, services to people that are also smoking. So it's certainly encouraged that in providing these services, we're also encouraging our staff to seek support for themselves. And finally, training, which of course is what one of the things that we want programs to have to support their staff. So there's two kind of key questions that are asked here in the training aspect. One of which is there training for behavioral health professionals, clinicians, and how much is that a regular part or a systemic part kind of built into staff development at your program? The other piece of training asks directly about training for prescribing clinicians, because that's certainly as important, if not, or as important, I would say, as making sure that general clinicians are trained, because again, the NRTs and the medications are such fundamental aspects of providing support. And we want to make sure that all staff that are going to be interacting, with clients are trained, have some basic understanding of, treating tobacco use disorder, and so that the whole team is working together to really, support people and provide a consistent message around the importance of this. And I didn't mention this earlier, but one of the kind of key things that we want programs to be communicating is that tobacco should be treated just like any other, co-occurring substance use disorder, right? It can be treated in a similar fashion, and it's as if not more consequential in terms of people's lives, either looking at health, finances, relationships, affecting people's work. It's in many ways, obviously, has a big impact. So these are all important elements that the TiSET helps people assess in terms of how their programs are doing. Now, I'm going to pass it on to Rusty, who will talk a bit more about how to actually conduct the self-evaluation.
Thank you, Noah. I'm glad to be here with everybody. That was a really good summary of the TiSET. And we're now going to talk a little bit about, well, you have the TiSET in your hand. How are you going to go about using it? How are you going to ask questions that are going to get you the information you need to rate how well the different items on these domains have been implemented? So there's 6 domains, there's 20 items. So what are you going to do? What are the steps? This is kind of the roadmap to doing the self-evaluation. So the first thing that's helpful is if you select or convene a self-evaluation team. And the team is going to be responsible for planning out the steps that need to be taken in order to collect the information, score, and complete the self-evaluation report. So if possible, you want the team to include representatives from different levels of your clinic or program. In other words, you want people to have different roles in the program who are going to bring different perspectives to be part of putting together how you're going to do the TiSET. And the first thing the team's going to do is they're going to create a timeline. That's the first task. So the self-evaluation team has a number of tasks that they need to complete in order to do the TiSET. So the timeline's the first step, okay? When's it going to start? How long is it going to take? And then you're going to talk about the different tasks that need to be done within the timeline. So can we go to the next slide? Okay, so after you do the timeline, then you need to communicate to your all the staff in the program what you're trying to do. And so, and you want to make sure that they don't see this as like a site review, as a critique, that you're gonna, it's judgmental, you're gonna, and it's so that they need to know that this is not about any particular person. This is about the program, and it's a quality improvement tool to find out where you guys are at in implementing all of the domains and all of the items in the TiSET. And so it's going to give you an overall view of how well you're doing in doing tobacco use disorder treatment, but it's not meant as a site review assessment kind of thing. And so because people need to feel that they don't have to tell you what you want to hear if you're talking to them about different items, they don't have to look good. The idea is not to look good. The idea is to get a sense about where you are strong in doing tobacco use disorder treatment and what areas you might need to improve. So this is a very important right from the get-go to make staff feel comfortable and understand why you're doing this. And the last thing is very important is not only should they understand it, but the team's got to figure out what to do, who gets the final report. I particularly think that at the end of this, all the staff of the program needs to know what the final result is, right? They've been part of the process. They need to know what the result is. So you know, your team might decide something different, but that's kind of where I'm at with this. So that's part of getting people comfortable in doing and giving information around the different items. Okay. So then there's a methodology. So you really need the team this is where you could divide up and do different parts of the TiSET. But somebody can do the environment, somebody could look at training reports, but it's important to get your information for the different items from different sources, okay? First of all, you would never want to do the TiSET with one person, for instance, because that's one person's perspective. So you might need to interview a number of people. You might need to interview people in different roles. You might need to look at the physical setting. How does it actually look? You know, somebody might need to go through the physical setting, or two people from the team and say, do we have posters up around tobacco? Do we have smoke-free signs up? What does it look like? Go to a group meeting. Are they talking about tobacco use disorders? If they're talking about co-occurring disorders, are they including that? You might want to look at documents, your electronic health record, your policy procedure manuals, brochures, and you're going to use all of that to come to some understanding for each of the items where your program's at in implementing that item, okay? So you get a whole bunch of, you gather a whole bunch of information. It's like data collection from a lot of different sources. You put it together, and that's going to give you final report. And it says click here for the TiSET chart review form. We're actually going to show you that on the next slide. Okay, and that's a live link, Nancy?
Yes. So when we send out the slides afterwards,
You'll get it. Okay.
Click to any of these links, yeah.
Okay, so here is, we put together this chart review form, and when you do the link, you'll get this. And when you're looking at your electronic health record or your chart, you're going to look at more than one, but you do want to look at people who have a tobacco use disorder to see these areas. And so these are different items around screening and assessment and diagnosis and treatment planning and whether the intervention matches the stage. We're actually in the process of editing this a little bit because we want to add some additional areas that you want to look at, like medication, NRTs, etc. But so this is how the chart looks. So this is how the form looks. So you would go in, you get 5, you can do more if you want, but at least 5 different charts, and you look and say, was the tobacco use screening documented? Okay. And was there an assessment of severity of tobacco use? So you're going to review the chart, and you're going to get a sense of, did these things happen, and in the different charts. And then you're going to use that information to score this item, okay, from 1 to 5. It goes from 1, not implemented, to 5, fully implemented, right? And so you could get you can, when you finish with this, you can get an overall score, and then you can get a score for each of the domains. Okay. And when when you're getting your scores, you're going to look and you can say, well, we want to move our item 6, tobacco use screening documentation, to from a 2 to a 4. Okay. And Nancy's going to talk about the type of report that you're going to get that will help you figure out what steps you could take. Okay. So that's the chart review form. So this is a tool that the team could use in gathering data around the program. Okay. So the other thing is you're going to want to interview people who work in the program. Okay. And you're going to work, and this is what the team's going to do, is going to say, who is it that we think we should interview or we can interview. Okay. And you want to be, when you do this, you don't want to say, oh, we're going to interview 25 people, because really when you do the TiSET, it should take you about a half a day. So you want to get a representative selection of roles and of staff and of clients people who smoke. You want to get a representative selection, but you don't want to have too many, but you want to make sure you have enough people that are going to give you a real sense of the different perspectives within your program around the different items. Okay, and so we have a link, we have another link that you're going to get, and they're like, we put together some questions that you can ask the directors, the staff, and never forget the prescribing clinicians, the nurses, clients. So here's what an example of the questions would be. So what kind of literature material? And by the way, some of these are closed questions. Where are they located? But some of these are open-ended questions. Okay, they're not just a checklist. Okay, did you do this? Did you do that? They're like, what kind of literature do you have? How is tobacco use addressed in your treatment plan? Okay, so you're going to get some in-depth answers to this that you then put. You're going to get the clinical staff. You're going to put all these together, and you're going to get a sense of where people are at in terms of the environment, in terms of treatment planning, and then you're going to use all that information to score your TiSET. So here's some, because you're going to be doing, the team's going to be doing the coding, okay? You're going to do the item response coding. So when you look at your TiSET, each item has a one, goes from 1 to 5, and they're basically decision rules and cutoff scores that help determine the ratings. So in the item will be a description of what does it mean to be a 1? What does it mean to be a 2? What does it mean to be a 3? Based on all the information you collected, and then you're gonna put that rating in that item. And this is very important. The ratings are based on what you're doing now, not what you did in the past. Oh, we used to do that, or what you're planning on doing in the future. It's what you're doing now. And if you have some discrepancy among your information sources, like a staff worker says one thing, the program director says another, your chart review has a slightly different sense about what's happening, you need to work as a team to resolve the discrepancy. So you say, this is what we're truly at, okay? And the self-evaluation team, when they're doing this, could talk among the team to come to consensus for the rating each item. And one of the things that a team can do before they could practice doing the ratings, they could work as a team to practice. So if you have a team of like 4 people, you have a item, an item, and you maybe say, well, where do we think we're at? Okay. And everybody separately scores the item, and then you talk about it, because not everybody's going to have the same score, right? And so you try to come to some agreement about how you would do the TiSET. Okay, so you practice scoring it, and then when you're doing it in real life, when you're actually doing it, then you have some experience doing this stuff, so you're going to easier to come to consensus. And there's this thing about, if you have these anchors 1, 2, 3, 4, if you say, well, we're not a 1, but we're not a 2 either, programs who are just doing this, it's better to do the lower score than the higher score, because then you're going to have room to grow in using your plan. Okay. If you say I'm a 2 and you're like not quite a 2, then you're going to think things are working out better, or you're doing better on it than maybe you really are. So you want to go to the lower score. That's just the kind of a rule of thumb. Here's some examples. Okay, so this is around tobacco-related diagnosis are in the relevant charts. Okay, so this is a chart review. You're going to look, and is this person's tobacco use disorder diagnosis documented? Okay, did somebody give them a diagnosis, and are they documented? So one is, you can see this is, one is tobacco-related diagnoses are not made or documented. Okay, so that's really a 1, because this is not an item that's been implemented at all. 2 is they're present in some records, but are sporadic and variable by staff. Some people do it, some people don't. Okay, and a 2 would be less than 50% of the records that you looked at had the tobacco diagnosis made and recorded. Okay, so you could see this. So the 3 is they're made and document, but a little more consistently than a 2. So it's 50 to 60. So these are percentages of your records. 50 to 69%. 4 is 70 to 89%, and the number 5 is 90% of the records have this the diagnosis made and documented. Okay, so it's really consistent. So that's a kind of example of how you would rate these. Okay, and depending on the results that you're getting from your information that you collected. We're gonna show another example, and then you're gonna have an opportunity to try this out. Okay, because it's very important to begin trying this to see how it goes. So could we do the next example? So the next example is, people have, stage of change, people are in different stages for different behaviors. So the question is, are the interventions that are in your record or in your interviews when you talk to people, do the interventions match the stage of change for mental health and tobacco use? Okay. So 1 is the documentation does not reflect any stage of change for anything. Okay, it's just not done. So that's a 1. 2 is the documentation has a stage of change sometimes, but it's very sporadic, and it's by staff. Some staff do it, some staff don't. Documentation is routinely present, but there are no specific stage-wise interventions for either mental health or tobacco use. So this is, the documentation has a stage change, but there's no specific stage-wise intervention for either disorder. 4 is it's routinely present, and there's an awareness of the stage-wise intervention, but it's more general, and it's related to the mental health disorder and not the tobacco use disorder. And the last one is it's reflected, stage is reflected for both disorders, and there's a stage-wise matching for both mental health and tobacco use. Okay, so you could see the more you go down this rating scale, the more the implementation is happening around this particular item. So can we go to the tryout? Okay, so we have a poll. I'll read it first and then we'll throw the poll up. So there are 3 prescribing psychiatrists and an advanced practice nurse at your site. Dr. Smith, is a pretty common name. Dr. Smith often prescribes nicotine patch or gum to people who want to try quit smoking, but the other prescribers do not do this. Other patients are sometimes referred to the primary care doctor or the quit line if they need nicotine replacement. No one is comfortable prescribing varenicline. What would you rate this item? Okay, so if everybody could try this, look at, we don't see any names. You can't really be wrong. I mean, you could be a little off, but there's no wrong. This is just practice. So if everybody could try this. I mean, I think we have 23 people on. So we're looking at, we want to get a 5 rating for the poll. So we need over 90% people to do the poll. Okay, we're good. We just got a little less than a minute. All right, we're gonna end the poll. Okay, so here's what people did. One person did 1. 11 people, or 61% of the people that did the poll, picked 2. 2 people picked 3, and 2 people picked 4. Okay, so the majority of people they picked the right rating. Okay, and its program offers sporadic access to tobacco use disorder treatment medications available without a prescription. Well, this is interesting because it could be 2 or it could be 3. 2 people picked 3 because Dr. Smith did prescribe NRTs, right? It wasn't just, here's a free nicotine patch. It said he prescribed. So you could say that it's a 3. You wouldn't quite say it's a 4 because it's, you would not think that 50% or 75% of consumers got, NRTs or medication, because there's only 1 of the 4 prescribers, including the advanced practice nurse, that actually do that. So it would really be less than that. So I don't know. I'm going to talk to Dr. Williams on this. What would you give, Jill?
I would agree. It's somewhere between a 2 and a 3 for the reasons that you described. So using your rule where we score down to give us room to improve, I probably would give it a 2.
Okay, and that's what most people did. But you could see you're not going to have black and white. You're not going to say, oh, this is obviously, I mean, sometimes you'll say this is obviously a 1, this is obviously a 5, but sometimes you really have to, as a team, meet and talk about this and come to consensus about the score. And just to reiterate, the reason, you give it a 2, what Jill said, you give it a 2, is then you really have, when you have your plan, and if you do it again and say you get a 3 the next time, it's a growth, right? It's improvement. So it doesn't mean that you would give everything a low score so you can improve. But if you're not sure about, should it be a 2, should it be a 3, go with a 2. So, all right. And I think that's my part of this, and I'm turning it over to Nancy.
Yes, thank you, Rusty. And thank you everybody for hanging in there with us. So now that you have your ratings, what do you do with them? So you can reach out to me at the email provided. And again, we are going to follow up with a set of these slides, and all these links will be clickable in the slides for you afterwards. And depending on, if it's one program and you've already, have it written down, I might just have you send it directly to me. But if you're a large agency and you have a number of programs, I'll likely set up an online link where you can enter the ratings into an online form so that it's easier for us to take a look at. You would be either sending me or entering all the ratings for the 20 items and the 6 dimensions on the form. And of course, if you're going through this at any point, whether it's as you're starting or, you get to a point where you're discussing the ratings, anything that comes up along the way in the process, please feel free to reach out to us. So once I get those ratings, next slide, please. Thank you. We'll analyze it. We will draft a report and email it back to you. I should reiterate, this is all free of charge to New York State providers. If you're in New York City, this is done as part of our New York City TCTTAC work. If you're outside of New York City, upstate, we can still do this as part of our focus on integrated treatment work. And these reports will show you where your program is at in comparison to other programs participating from your agency, if you're doing that. And if it's a follow-up report, the comparison will be with your baseline. The report also includes very specific recommendations in each of the areas. And importantly, it's based on your self-rating. So it's not one of these general reports that says, oh, if you've got a 2, you can try this out to get to a 3. If you got a 3, you can try this out to get to a 4. This report will be very specific. It says you rated yourself a 3. So you may want to consider X, Y, and Z to get to the next point. Once we give that report back to you, it's really up to you and your work group and your self-evaluation team around what steps you want to take based on that report. So we will give you some recommendations. We are certainly here and willing to work with you if you want to develop an implementation plan and follow the roadmap, or you have a work group and you'd like those meetings. We are more than happy to, continue providing support to you while this is ongoing. But again, it's really up to you to decide, what do you think you can do? We might say, recommend pick something easy. Okay, you can put up some posters, you can put some brochures around. That's usually an easier lift. Pick something you think you can do. Okay, we have half of our staff trained and maybe we want to get 75% of our staff trained. And then you might pick a goal that's a little bit more of a stretch for you. But again, whatever you decide, it's up to you and your team. Next slide, please. This is just an example of a report that we did for an agency where you can see the lighter blue line is what the program had scored in these different dimensions. And the darker blue line was how all of the housing programs in their agency had scored in those same domains. So it gives them sort of a point of reference, how they're doing in comparison to other housing programs in their agency. And you'll start to see below there is the first domain, policy and administrative. You get the overall score, some resources that can help you in those domains. And then, as I described before, it says, this was what your response was, consider taking these next steps. Next slide, please. So as Jill and Rusty and Noah, I think mentioned earlier, you can use this report to really help guide an implementation plan. And that does include, specific goals, objectives, interventions to get to the goal, people who are responsible, projected target dates. So for example, you might choose, have our staff trained. Well, what would that look like? Well, we want 75% of our staff trained. I'm going to put our training director responsible, and we're going to achieve this by sending everybody to that TICTAC training in the fall when those dates come up. Jill mentioned earlier the Treating Tobacco Roadmap, which also basically outlines this whole approach and these steps. That is available on our website, on the tools page, along with all of the other forms that we discussed here, including the TiSET, the review forms and the chart review forms, staff and leadership surveys. So all of that's there. We're here to help and support you as you're going through this. And you can think of this as a nice process measure in and of itself. So if you are working on some of these goals and you would like to repeat the TiSET in 6 months or a year or whatever time frame you think you need to achieve the goals that you've set out, then you can submit to me again the follow-up TiSET, and then we will provide you with a report that compares your baseline to follow-up. So on the previous slide where you saw the housing program compared to all housing programs, that graph would now look at baseline compared to follow-up. Next slide, please. So again, we just wanted to bring back this wonderful diagram that Dr. Williams sort of put together to help us think about, that we can take a look at the steps for addressing tobacco treatment in your program. This TiSET can be a really helpful first step to anchor your work and develop an implementation plan. The Treating Tobacco Roadmap gives you some step-by-step work that you can do in each of the domains that correspond to the TiSET. And the feedback arrow shows that this can become part of a continuous quality improvement, because when we send the follow-up report, it also includes recommendations. Here's the change you made from baseline, and these are great improvements. And, here's some additional things you can do if you want to continue working on implementing tobacco treatment. So it can become part of your continuous quality improvement cycle, and you can repeat the TiSET as often as you like. I know we've spoken to some programs who find it useful to be able to use those reports to demonstrate that they've engaged in this process and made improvements during licensing visits, for example. Next slide. This is just a screenshot of the roadmap that you can find on the website. And you also see the screenshot of the page that talks about creating the implementation plan and how that maps to the different domains of the TiSET. Next slide, please. Again, mentioned this earlier. The roadmap is really a number of resources that are organized around the domain of the TiSET. You can access it on our tools page, and we'll be sending all of this out after this webinar. Next slide. And now that brings us to questions. And I see there were some things in the chat box that I couldn't read while I was speaking, so I will mute now and take a look.
So please put your questions in the chat box. We're happy to take any questions that anyone has. We had one question earlier just about the chart review form that Rusty presented. Just to clarify, that is assuming that you're doing chart reviews of 5 or more specific patient charts. Yes, that was referring to that those were the patient charts we were talking about. A lot of people are requesting documents and resources, and Nancy will send those out when we're done. I don't know if anyone else has any questions about any of the things we talked about today. You also can unmute yourself if you'd like to ask your question out loud. We will welcome any questions on anything we talked about.
This is Tom from Buffalo. I'm assuming that this instrument could be used for an inpatient program as well as an outpatient program?
I'll go first and then
Mhm.
I'll invite the rest of the team to respond, but absolutely, it's not specific for any kind of site. You could absolutely use it in an inpatient setting. It's designed really for any general behavioral health program. And I think all of this would apply to an inpatient setting. Does anybody want to add to that?
I completely agree. And I would also say that if you're in a setting where one of the domains doesn't apply because of how your program is set up, for example, you don't have routine prescribers on site, that's okay. When you submit the ratings, you can just let us know, look, this is how our program is structured. We don't have prescribers on staff. We're never going to have prescribers on staff, but we want to work on these other domains.
Okay, so a follow-up to that. So for a housing program, for instance, where we don't have professional staff, we would just not necessarily address that domain.
You mean prescribe? So you might not address prescribing the medications because that may be happening, say, in collaboration with the clinic. But there are definitely interventions that the non-licensed staff can and I think should be doing with the people who are in the housing programs. I don't know, rest of team, what you would add to that.
Yeah, and I mean, with regard to medication specifically, I mean, I think there's different ways to accomplish this goal. So even if you have no medical professionals or prescribers per se on your team, you might be linking people in other ways to get them access to treatment medications through the quit line, through other local providers, even taking them to pharmacies and somehow helping them access it. So if you're meeting the goal, I think in other ways, I think it's okay to sort of make that rating work for you in your setting, even if it is somewhat modified.
Right, that makes sense. Thank you.
This is Rusty. I just want to make one comment, which is a number of people, when we did the initial poll, said that they had implementation plans are in place. And I'm thinking, well, you can always, a lot of times we say, use the TiSET as a baseline for building an implementation plan, which makes a lot of sense. But if I had an implementation plan and I had it in place, I might use the TiSET at some point to say, well, how are we doing with how is our implementation plan doing in relationship to these domains? So it doesn't have to just be a baseline. It could be like a quality improvement instrument looking at what you've been trying to accomplish with your implementation plan, if that makes sense. And I just wanted to say to Tom, I think the TiSET is like a terrific tool for instrument for inpatient units. I can't think of any domains that wouldn't apply to the unit. The only thing that's not on it, if I'm an inpatient, is the discharge and continuity of care. Because I do know that people say, well, people are given NRTs when they're an inpatient because they can't get the smoke, they can't smoke. So they're given NRTs, but then when they're discharged, they're not given a prescription for NRTs. So I'm not sure where that would be, but I would think that would be an area that inpatient units would try to pay attention to.
Yeah, thank you, Rusty. That is part of where I was going with that question, is that we are struggling with a number of folks that are discharged from our inpatient to our residential who pretty quickly relapse to significant tobacco use. And there's very limited NRT prescribed on inpatient, primarily just just the gum or the lozenge. We're trying to encourage the idea that there needs to be a long-acting and a short-acting modality for the NRT, and also trying to kind of get all parts of our facility to work together on this project. So
Wow.
looking to use this tool as perhaps a springboard for that type of evaluation and process.
Wow, that's great. Tom, I'm glad we're recording this webinar. Because that's great that you said that. That's, because it is a systems issue for a lot, in a lot of places, right? If they're in residential, a lot of times they're getting their clinical services from the clinic in the facility. And right. And they need to have a coordinated effort. It's not easy to quit tobacco, nicotine. Hi.
Can I say something?
Yes.
Maybe that sounds weird, the way I'm probably going to express myself, but I'm agree with you in the case, Mr. Foster, that is not easy to quit tobacco. In my case, I don't smoke at all, and I'm not even drink. But you guys doing a great job, and we try to do all the best in order for us to help others. But unfortunately, what I'm seeing in right now is that no matter how hard you work, but the state continuing approving legislation in favor of the tobacco stuff, and this is why it's not gonna end. I hope one day all of this is going out of our life. This is what we want, and this is what we work for. And as the organization that I work for, Balcher Street, they working very, very hard.
Yeah.
And we try to do all the best. Thanks to them, I have what I have today, my job, right? And I do all my best to help all people, all the best I can for all of them. But we have to work together.
Yeah.
Not only your organization, but the state.
Yeah.
The state also need to be together with us. That's what I believe.
Yeah. Yeah, I agree with you. And it's like, the bottom line is it's the people we serve that are the important piece of this. And so the reason that we're doing this work is because we know that smoking is really ending people's lives a lot earlier than their life should. And people who have mental health conditions or substance use conditions or both smoke a lot. They smoke, and we need to help them figure out how to live a little healthier. So I agree with you on that. I'm not going to be able to say your name correctly, but I'm going to try. Nafis.
How you doing?
Is that it?
Nafis.
Yeah. Oh, this was Ramon we were talking to.
That's me. That's me.
My name is Nafis Rashid. They spelled my last name wrong.
Yeah. It's Rashid?
Rashid, R-A-S-H-E-D.
E-D. Okay.
Yeah, basically, I like to piggyback on what Ramon said. A lot of people smoke. We try to help them. They're in the communities which we are in. You got to self-medicate yourself.
Yeah.
With substance or alcohol.
Right.
I mean, lack of job opportunities, lack of education. You're having trouble taking care of your family. You can't afford to put food on the plate. People are self-medicating themselves. Tobacco is so easy to get. It's a drug, but you got kids selling, you got stores selling loose cigarettes to little kids now.
Yeah.
You know, tobacco goes a long way back, you know, and it's not going anywhere. They just legalized marijuana here in New York.
Yeah.
So, I mean, we have to make sure that this next generation understands that what you said, tobacco kills a lot of people off at early in the age. Or this vaporing and this nonsense going on. We have to make sure these people realize that they have to stop at some time. And we all we can do is keep doing outreach, helping those who suffer from tobacco use. And if we can just continue to outreach and don't judge them on what they do, because like I said, they may be dealing with mental illness. They self-medicating themselves. I have a friend I used to do business with. He died. He smoked like 2 or 3 packs a day with a bottle of Philadelphia liquor. You know, so we just gotta keep on top on our game as facilitators and help those who do smoke tobacco, help them out wean themselves off as soon as possible.
Well, I agree like 100% with what you just said.
Yeah.
It's like, stress, trying to cope, and the types of stress that people have in their lives. And it's kind of terrible because they pick the way they cope is things that make their lives actually worse.
Exactly.
Yeah.
Exactly.
So we have to help them find a little healthier way to deal with what's going on. We have
Absolutely.
to find, go ahead.
I know we're over time, and there
I'm
was some there was some medication questions in the chat box that I just didn't know if Jill had a minute to address before we.
Sure. So there was a question about if someone's receiving nicotine replacement in the hospital, would it be appropriate to discharge them on varenicline? And I would say that's a complicated question. So I would never want to change somebody's medication at the time of discharge. So we try not to do that just to it complicates things. On the other hand, there's no problem using varenicline in the hospital. So varenicline or Chantix is a highly effective medication. It helps people stop smoking. It stops craving and withdrawal. It should absolutely be used in outpatient and inpatient settings to help people recover from this problem. So I'm not opposed to using it. I'm not sure though, I would give people one medicine in the hospital and then switch them at discharge to a brand new medication. That's probably not the best way to do it. Somebody else asked about using nicotine and varenicline together in the same patient. And I would say that's something we generally avoid. The way varenicline actually works is by attaching to the nicotine receptor. So most people would not give nicotine in addition to varenicline. It may not be better, and it actually can cause people to have more side effects. So that's a combination we would actually avoid. So thanks, Nancy.
Sure. And thank you, everybody. I don't know if, folks have additional questions. If I know I can hang around for a few more minutes longer, otherwise, you really appreciate your time, your attention, and reach out at any point, either with your ratings or with questions about how to do it. We look forward to, helping you with this.
Thank you, everyone, for joining us today.
Thank you.